The first tip is to just realize how important gut health is for kids developing brains and for adult brains too. We know how intimately connected the gut microbiome is to brain development and brain functioning. And it's fascinating when you look at the makeup of your gut microbiome, how that can influence our moods, our cognitive processing, our sleep, our stress response. And when we have, I would say for all kids and adults, but especially for kids and adults who are highly sensitive, who are neurodiverse, it's really important when we're trying to navigate the world and make the world feel safe. It really does start with the gut microbiome. And there's so many facets to that.
Hi, conscious parents. It's Carrie here, and I am here with a little info about raising our mindful kids. I've got some tips and tricks about breaking free of the box and becoming who you are and teaching your kids how to do that along the way. Join us. Hi there, and welcome back. It's your friendly conscious mom here, and I am so excited. I'm a huge fan of the guest I have today. I have Dr. Elisa Song here. She's an integrative pediatrician, and she is on a mission to revolutionize the future of children's health. I love your mission, Dr. Song. I'm so excited to have you on Heart to Heart today.
Oh, I'm honored to be here.
Yeah, it's been so fun to chat with you beforehand. I was listening to some of your recent podcast guest spots, and I love how much you're sharing about gut health. And in our family, I was sharing with you, we have two neurodiverse kids. We're all highly sensitive people in our family. We're noticing a lot of inflammation in pieces when we eat food. So there's been a lot of food intolerances in our house. So, as far as gut health, in our house, we all hear about probiotics. We hear about eating a variety of vegetables. And fish oils has been something we've included. Are those the main pieces that I should be looking at with gut health, or are there other tips that you would share with us?
Yeah, I think the first tip is to just realize how important gut health is for kids developing brains and for adult brains too. We know how intimately connected the gut microbiome is to brain development and brain functioning. And it's fascinating when you look at the makeup of your gut microbiome, how that can influence our moods, our cognitive processing, our sleep, our stress response. And when we have, I would say for all kids and adults, but especially for kids and adults who are highly sensitive, who are neurodiverse, it's really important when we're trying to navigate the world and make the world feel safe. It really does start with the gut microbiome. And there's so many facets to that. And I will say that one of the foundations that we can't ignore when it comes to the gut microbiome, really, they are, of course, diet and lifestyle factors, which then, when you have a kid who may be a little bit more sensory from an eating standpoint or texture standpoint, it can be challenging to think about how to do that. But I talk about really the five things that create microbiome magic, and there are five things that we do every single day. So I'm trying to frame this in a way for parents and for kids that make it really doable. Okay, we're doing these five things every day. We have to eat every day. We have to sleep and hydrate and move and breathe every day. And if we learn how to do those, make little tiny shifts in how we do those, then we support and nourish not just ourselves, but our microbiome, because our microbiome, its job is to really keep us healthy and happy. And we could dive into whichever piece you want, but you already mentioned some. One of the things that we have to think about is what are we getting in that is nourishing our microbiome? Because again, that connection between the gut and the brain and the microbiota, these organisms, hopefully friendly organisms that live in your gut microbiome, they're responsible for making the majority of our quote brain chemicals or neurotransmitters like serotonin, which helps us feel relaxed and calm and manage stress and get restorative sleep, dopamine, which helps with attention and focus and staying on task and staying motivated, acetylcholine, which helps with processing speed and connecting the dots in your brain. And if your gut microbiome is not filled with all of these beneficial bacteria that make these neurotransmitters, it's an uphill battle trying to feel calm and safe and motivated. And thinking about what our microbiota need to flourish and thrive. I call them the three F's just to try to make them memorable.
Mm.
Fiber, which
Okay.
includes not just fruits and vegetables, but whole grains and nuts and seeds and beans and legumes. In fact, beans and legumes and whole grains tend to actually pack more fiber punch per bite. So we want to include those when we're thinking about fiber. Phytonutrients, which is actually a pH, but it sounds like an F. So phytonutrients, that's color. It's fascinating. Each of the different colors that our plants can come in that we eat provides a different nourishing power to our microbiome. And our microbiome converts those phytonutrients into things that we need, just like the neurotransmitters that we were talking about. And then we have fermented foods. Now, fermented
Mm.
foods are an amazing addition to everyone's diet if we can, I'm not going to say if, when we can get it in, right? So fermented foods, I know for my own kids, it's a little bit of a harder sell, but as they get older, I was telling you they're 15 and 13, they
Yeah.
are starting to like more and more the
Mm.
sour taste of sauerkraut. They do love kombucha, of course. They have yogurt, which is fermented dairy, but if you can't tolerate dairy, then having other cultured, there's cashew yogurts and coconut yogurts that can provide the fermented foods. And what's interesting about fermented foods, a lot of people think, oh, it's so good for my gut because they have probiotics. What we know now is that the probiotic content of a lot of fermented foods is actually very low. And that's only
Mm.
part of the picture. The biggest benefit is probably because of the fermentation byproducts, what are called
Mm.
postbiotics. Let's take sauerkraut. When you have cabbage that you put into a brine of salt and water, and then all the bacteria in there, the probiotics start to eat and digest that cabbage. The cabbage acts as a prebiotic to feed the probiotic. And then as the probiotic is digesting and fermenting the cabbage, it creates these byproducts that are called postbiotics. And these
Mm.
postbiotics are what provide us the health benefits. And they are things like our neurotransmitters, vitamin B12 and folate, vitamin K, short chain fatty acids like butyrate, which are so important for brain and metabolic health. And if we can get in all of these three champions, these microbiome champions, work on it gradually, that is going to really help your and your child's gut microbiome build that foundation of health and resilience so that
Mm.
if something happens in life where maybe you're at a party and you're having some foods that are not as nourishing to your gut microbiome, it can bounce right back. Or maybe you've needed a round of antibiotics, and we know how
Mhm.
disruptive that can be to your microbiome. So we have those foundations, and it can bounce back much more quickly.
Okay. Wow. Yeah, that's really helpful. I had forgotten to mention fermented foods. That's definitely one. I'm really lucky. My almost 10-year-old and almost 7-year-old love vinegar. Fermented foods is one. And they love kombucha. Is that something that we can give our kiddos? I know there's some caffeine in there. I'm always
Yeah,
curious.
yeah, it's interesting. So kombucha, the SCOBY, which is the if you've ever made kombucha, first of all, it's the most fun thing you
Mm.
can do. It is so fantastic.
Oh,
When I actually created a 6-week curriculum, this elective for my daughter's third and fourth grade combined class,
cute.
and we called it Healthy Belly, Happy You. And we talked all about their gut microbiome, their tiny little friends in their tummies, and how to keep them healthy and happy so they keep us healthy and happy. And we made fermented foods. We made fermented lemonade. We made
Mm.
sauerkraut and we made kombucha. So it's a way to think more broadly outside of some kids don't like sauerkraut or pickles just
Mhm,
yet. And
mhm.
but they may love fermented blackberry lemonade or
Yeah.
popsicles made from fermented fruits and different kinds of
Oh.
fermented vegetables. And I have actually a bunch of different recipes in my book to show you how easy it can be to really
Great.
ferment foods. But kombucha, absolutely. With kombucha, there's this. It's not just bacteria, friendly bacteria. It's this symbiotic culture of bacteria and yeast. That's called a SCOBY, and it's this little round. I can't even. I guess that you would describe it as almost like a pancake shape. Little. It's like a colony of these teeming with organisms,
Wow.
and when you put it into tea and add some sugar or honey. When you use honey, it's actually called jun. It's like kombucha, but it's delicious. And it's just as delicious as kombucha. But some
Mm.
people will think, oh my gosh, there's so much sugar that I have to put in to make
Hmm.
the kombucha. And there's a lot of caffeine because you're using black tea or green tea. The SCOBY actually eats and digests the sugar
Oh.
and the tea, the caffeine in the tea, and also some of the other phytonutrients in the tea to create the kombucha. So the end product has very little caffeine and can have very little sugar depending on what you add to it to flavor it if you do. So I do think now you have to be careful at the end. Sometimes kombucha can have alcohol if you add a little sugar at the end
Mhm.
to give it more flavor. So that's the only thing. But you can buy kombucha now that's tested to not have alcohol, and you can look to see and make sure that it has a lower sugar content. And I think it's great to give to children. Vinegar is an interesting thing because you said your kids love vinegar. Vinegar can taste like fermented food, but it actually is a different process. When you use vinegar, let's say
Mhm.
with a cucumber, you're actually pickling it.
Mhm.
And so both pickling and fermentation were processes that were developed way back in ancient times, like the
Mhm.
Mesopotamian times, let's say,
Yeah.
to really to preserve food so it didn't spoil because they had no refrigeration back then. And they're different processes. Fermentation will create this culture of friendly bacteria that helps to preserve the food. On the other hand, pickling with vinegar actually kills all the bacteria. It's a
Oh.
different process. If your kids love pickles, what I suggest is a pickle made with vinegar and cucumbers are still great because cucumbers are healthy for you, right?
Mhm.
But if you want the fermented kind, then you want to look at the label and look for a pickle that's made with cucumber, salt, and water, and some spices. So you just have to read the
Mhm.
label to know.
Okay. Oh, that's really helpful. Oh man. So we always dip all of our vegetables in oil and vinegar. Is that killing some of the bacteria that we're getting?
No,
Okay.
no,
Okay.
it's yeah.
I'm like, oh no, that's how I get them
I
to
think
eat
that's
broccoli.
great. Yeah, absolutely.
Okay. Phew.
And it's interesting, olive oil, you mentioned fish oil, but the omega-3 fatty acids found in fish oil and then also
Mhm.
olive oil, they have been found to have prebiotic properties. They actually
Oh.
can help support the growth of friendly bacteria. I love that. Dipping in the
Mm.
olive oil is perfect.
Okay. Shoot. I swear, as a speech therapist, when I go around and I hear picky eaters, I'm like, have you tried oil and vinegar? So I'm glad to hear that it's still good. It's
It's still
still
great.
helping. Okay,
Yeah.
good. I think you mentioned when you were talking about some of the pieces like the serotonin and such when we have our good gut health. I would love to dive into the behavioral things that we see and the emotional pieces. I go around and I share these pieces that I notice such behavioral changes with my kids as we work to heal our gut, as we've eliminated for in our family, we had to eliminate gluten and dairy.
Yeah.
We noticed just such a big positive change for our kiddos. Would you be able to explain a little bit more about that for us with the behavior pieces and even
Yeah.
emotional pieces? Yeah.
Absolutely. The disruption to your gut microbiome, whether it's as an adult or a child, can have significant impacts on your behavior and your mood.
Mm,
And correcting that, healing your gut microbiome can also be this profound moment for parents, just realizing, oh my gosh, that's it's not just their temperament. There was something else going
mm,
on, right? And we don't
mhm,
want to chalk things up to, oh, that's just how so and so is. Yes, we each bring with us our unique temperaments and our unique individual strengths.
yeah.
And yet, we know that certain gut microbiota can influence how we think and how we feel. That's really important. For instance, you can have, when we have an imbalance of gut microbes, it's called gut dysbiosis. That dysbiosis can occur in several different ways. Sometimes we just don't have enough of the beneficial bacteria, so not enough of the good guys. And
Mhm,
these good guys, as we just were talking about, make our neurotransmitters. If you can imagine, if we don't have a lot of serotonin being produced, our brain doesn't have enough of the feel good hormone to be able to manage stress, to be able
yeah.
to calm down and unwind when we're upset about something, to remain happy and relaxed. And it becomes an uphill battle when we're trying to work on the behavioral component if we're not supporting serotonin. Or let's say you have a child who's really wiggly and can't pay attention and can't stay
Mhm,
on task, and you feel like, gosh, I'm constantly redirecting and it's getting exhausting. If their gut microbiota are not making enough of the dopamine to stay motivated and on task, it's going to be a struggle for everybody involved, right? If we can support your child's gut microbiota to make a healthy amount of neurotransmitters, it's going to just help things be more smooth. There's also been studies looking at infants and looking at their gut microbiota, and it was really interesting. We also know that girls and boys microbiota are different as well, and also that what's ideal for you may not be ideal for your sister or for your cousin or for your friend. Our microbiota is just as unique as we are, but we can see these patterns of differences between sexes. And we can also see there were a couple of studies looking at infant microbiota, and it could be on a certain level predictive of certain temperaments, whether it's an anxious temperament or an outgoing temperament. And it's fascinating to think that could play a role, but it does, right? So that's not enough for the good guys. Now, we can also have too much of maybe the not beneficial bacteria or yeast or parasites. And each of those create their own compounds that then can get absorbed into our bloodstream and also affect how we think and behave. When we think about, for instance, there's a certain category of bacteria called gram-negative bacteria that can make something called endotoxins and can create inflammation in the gut. And I have had kids I'm just thinking about this one teenage girl with really severe anxiety, and she improved with some dietary changes, and we gave some calming supplements. But the last piece was really getting rid of these abnormal bacteria in her gut and getting rid of the toxins that they were producing that were really clouding her brain. It made a tremendous difference. When we have yeast overgrowth, also, for parents listening, these bacteria and yeast or parasites, these abnormal bugs, can tell our brains what we want to eat. If you have a child who's on the pickier side, guess what? It may not be your child's brain dictating what they want to eat. It literally may be these organisms in their gut saying, I want this, I want that. And yeast in particular, what do yeast feed on? If we talked about kombucha, right? They need sugar to eat. If you've ever made bread, what do? You warm up the yeast in a little water and you add some sugar to activate it and feed it. If you've ever brewed beer, it needs sugar. And so yeast want sugar. And so when your child has a lot of yeast in their gut, maybe from a round of antibiotic previously, or maybe this is just their tendency, those yeast send out signals to say, feed me, and your brain all of a sudden starts craving sugar. And also with yeast, one of the things I ask parents to give a tip off of whether or not yeast could be in the picture is by the time we're an adult, most of us have either personally had the experience or witnessed other people maybe having a little drink one too many, right? And being a little tipsy or even being a little drunk. And how have we seen people experience that? If you've had a little too much alcohol, you might be really sad and weepy and depressed and want to be left alone. You might be really angry and aggressive. You might be really giddy and goofy and spacey. Or you might just be confused and hard to concentrate, right? And clumsy. Yeast, when they eat sugar, they create these alcohol byproducts that then get absorbed into our bloodstream. And a lot of parents, after their kids eat a load of sugar or maybe a huge bowl of pasta, which gets converted to sugar, they're like, oh my gosh, they're a different kid. If you've ever noticed these behaviors that occur shortly after eating a big batch of whether it's sugar from candy or cakes or whole grains and carbohydrates that get converted to sugar, that's a tip off to me that there's an overgrowth of yeast. And if we can manage that, the behavioral component can get so much better. And then parasites, we often think of, oh, that's not a problem in the United States. But many kids and adults in the United States have parasites. They are not just a third world problem. And parasites are really interesting because they have a cyclical pattern. Just all animals in the wild are affected by moon cycles, and animals give birth during the full moon. And there's a pattern to this. And parasites, too, often tend to be a little bit more active around the full moon. That's another tip off for me. If kids have more aggression, tantruming, sleep problems, tics, whether they're motor tics like an eye blinking tic or throat clearing tic, that seems to come and go. And then you start noticing, it actually seems like maybe it's around the full moon or it has a cyclical nature. That's a tip off to me that maybe there are parasites and we want to do some investigation into your child's gut.
Wow. Wow, that's really informative. I would never have thought of that. I would have just attributed it to the full moon. Really interesting.
Yeah.
Wow. Okay. Thinking about our gut, and I know for us, as we started to look at our gut health, look at inflammation in our bodies and what
Mm.
that looked like in our house, we noticed pieces that were connected with ear infections with my kiddos. And then I wanted to check with you about the inflammation pieces. You had mentioned there are starting to see connections with people on the spectrum and inflammation. So, what can you tell us about inflammation and pieces with that?
Yeah. We also just the gut and brain are intimately connected. So is the gut and your immune system.
Mm,
And 70 to 80% of your immune system lies in your gut. And
mm,
so our gut microbes can communicate with our immune system, and that can then inform how we respond to things, whether it's foods
yeah.
or bacteria or viruses or environmental toxins. And
Mhm.
when our gut is in a healthy state, we know that our immune system then can act appropriately, get sick every once in a while. That's a normal
Yeah.
part of life, right? But then get over it and not always tip over into having an ear infection or a
Hmm.
bronchitis and a lung
Hmm.
infection or whatever it is, right?
Yeah.
Um, and when our immune system becomes disrupted, that we know that can increase the risk for immune problems, especially allergic problems, because we know
Mm,
a lot of kids with neurodiversity also seem to be more at risk, a higher correlation of things like asthma, eczema, allergies, hay fever,
mm,
hives. And there was a very large study that was done in 2016. It looked at, wow, that's almost 10 years ago now.
yeah.
It looked at 800,000, nearly 800,000 births. It was
Mm,
a military study, and they looked at infants who received antibiotics or antacid medications in the first 6 months of life. Now,
mm,
why those medications? Because we know that those impact the developing gut microbiome pretty immediately. And they followed those babies for the first through several years of life and found that those babies had a significantly increased risk, almost double the risk, by the
wow.
time they were 4 years of age, of virtually every single allergic disorder like eczema, asthma, hay fever, hives, and even anaphylactic food allergies. Now, when I was in
Wow.
training, this is years ago, decades ago, we didn't really see kids with anaphylactic food allergies. Now, 1 in 12 to 13 kids
Wow.
has anaphylactic food allergies. And we have to
Yes.
think what is going on. And so if we understand that how your gut microbiome is shaped and develops and continues to develop impacts your immune response, then we can prioritize as parents and doctors your baby's microbiome, your toddler, your child, even your infant microbiome. And I point that out because a lot of parents listening will think back and think, oh my gosh, my baby had antibiotics when they were 2 months old. We can't
Hmm.
go back and undo that, but
Right.
we can now know, all right, my child's poop looks perfect. But I'm still going to look at their gut because I
Hmm.
know now that connection between their gut and their immune system and their gut and their
Yeah.
brain health. It's the first part is just knowing and understanding, and also knowing that we can always move forward and heal your child's gut microbiome and your gut microbiome at no matter what point. And I see this even in just as important in adulthood and teenage adolescent years. I see a lot of not a lot, but I have several parents in my practice who, when they were younger, they could eat everything. And then all of a sudden, in their
Yeah.
20s or their 30s,
Yep.
now they have outright allergic, even anaphylactic reactions to foods that they ate all through childhood and adolescence,
Hmm.
right?
Yep.
And we also know in adults that after one round of antibiotics, that significantly increased your subsequent risk of developing depression and anxiety or mental health disorder. And it's not a
Wow.
done deal though. If we know that, then we know, all right, if we take the antibiotics, first, let's make sure that it's absolutely necessary. And let's make sure that we understand how to recover your microbiome so that you don't have an increased risk of developing allergies or anxiety afterwards.
Hmm. Whew, there's a little heaviness, I think, as a parent in if we did have to do any of those things, right? You think in your
Absolutely.
past.
Absolutely.
Like, whoa,
Absolutely. And that's why I
let's
always
try
want to
our
let parents
best.
know we can always move forward. And that's where it's just
Yeah.
the first moment, the first awareness, aha
Mhm.
moment is always one that's like a gut punch, no pun intended, but you're like, oh my gosh, is that why? Is that part of the
Yeah.
picture? And but part of the picture when we look at things from an integrative, pediatric, and functional medicine standpoint, it's all about telling your child's story. What is the
Mm.
story that really brought them to this place where they are today? Because if
Yeah.
we understand the story, then we know, okay, where do we need to dive deeper? Where do we need to do more investigation? And I tell everyone, both of my kids had antibiotics when they were
Yeah.
under 5 weeks of age. My son
Ah,
was exposed to strep, and he actually had pus
yeah.
coming from his ear when he was 2 to 3 weeks of age. And
Hmm.
my daughter had a urinary tract infection when she was 2 weeks of age. And those are absolutely necessary times to use
Yeah.
antibiotics.
Yeah.
And I was fortunate enough to know, okay, let's give probiotics. Let's try to
Hmm.
give some nutrients. And while I was nursing, try to eat more things that can help their gut
Yes.
recover. But even now, for me, they're 15 and 13. I think back
Hmm.
and I have these thoughts of, wow, I wish I had known what I know now. We're always going to
Yeah.
have those thoughts, but
Yeah.
you know now. And that's the amazing thing, right? You know now, and now you know where you can start.
I love how you're sharing this with parents because I feel like when we go to a pediatrician, we're oftentimes afraid of asking questions. I know when my son was first born, he's the one that's almost 10, he had a lot of reflux in it whenever I would eat dairy. And I had it in my heart, this feeling of, I think it's the dairy. I think it's the dairy.
Mm,
And the doctors had said, let's put him on anti-reflux meds to help him so he
yeah.
can sleep because you're not getting sleep. He's not getting sleep. Everybody's unhappy. And I had it in my heart, I don't want to do that. And I didn't have the reasoning why. I didn't know why. I said,
Yeah.
I'm just going to try backing off of milk. And I also had it in my head for some reason, gluten. And I said, I'm just not going to give him gluten. When he started eating, we didn't give him dairy or gluten. We had it in our
Yeah.
hearts. We didn't have the reasoning why, but when he was 12 months old, he ate a regular pancake and we watched eczema go up his back.
Mm,
It was really
yeah.
interesting. It was
Yeah.
like I had that feeling.
Yeah. And you always want to trust your mama instincts and your
Yeah.
parent instincts. It can be really intimidating when you're at the doctor's office and
Yeah.
like you said, you don't necessarily have the articles or the research or even the way of talking about it
Yeah.
to explain what you're
Mhm.
feeling and what you're thinking. But you don't have to have that. I mean, if you
Yeah.
have this instinct telling you, I'm not sure about this, I think there's something different going on. I mean, it's so important to be able to have a partnership with
Mhm.
your pediatrician, your own doctor, to be able to have those conversations. And
Mhm.
the interesting thing about gluten and dairy, especially for our neurodiverse kids, there's a couple of
Mhm.
different factors with the gluten and the dairy. Gluten and dairy, casein is what the major protein in
Yeah.
dairy, cow's dairy, and also sheep and goat. So casein is that major protein, and gluten is the major protein found in a lot of grain products, including wheat, barley, rye, spelt, kamut, which I don't know how many people eat that, but both gluten and casein are highly inflammatory.
Yeah.
Soy proteins can fall into the same boat.
Mhm.
And there's a Dr. Alessio Fasano in out of Boston Children's. He's a pediatric gastroenterologist that really brought this awareness of
Mhm.
celiac disease and non-celiac gluten sensitivity to
Mhm.
light in the research world. And he's brilliant. But what he's identified is that the gluten protein can trigger gut inflammation and something called leaky gut
Mhm.
in all people, not just people with celiac disease.
Mhm.
And we see a similar phenomena with casein and also with the soy, sometimes soy proteins. But gluten and casein in particular, when you have a tendency to get problems, can be really problematic. And also for certain sensitive kids and adults, the gluten and the casein protein then can get converted into an opioid-like compound called
Wow.
gliadomorphins or casomorphins. So some parents, after the kids have gluten or casein or just one of them, both or one, will notice that their kids act literally like they're drugged, like they're spacey, or maybe they're aggressive or clumsy. Their writing gets really sloppy. Just these different they're different until it
Mhm.
can wash out of their system. That has to do with these opioid-like compounds that are being produced. And for some kids and for some adults, they'll get the similar phenomena that it is important to avoid, just like you're finding.
Wow, that's really interesting. I recently, because we are so aware of what our kids are eating in our house and we're always watching, and I use, like you said, the mama gut for watching for the changes of behaviors. We recently ended up doing some food dyes at a work party for my son, and we noticed he sounded like he was slurring his words
Yes.
at dinner, and he said, "I feel funny. I feel really sleepy." And also, before that, he had this huge behavior impulse control moment, and just it was wild. We were like, this is really intense. We don't have food dyes,
Yeah.
so we didn't even realize like one red popsicle could do this to him. So,
Yeah.
what are your thoughts on food dyes? I know I feel like it's a touchy subject. I don't know.
I think that artificial food dyes should just be out.
I
Period.
agree.
They're so inflammatory. And at this
Oof.
point now, there are enough studies on how harmful they can be for kids' brains. And
Mm,
for kids who already have a diagnosis of ADHD, it can be especially problematic, but for
yeah.
all kids. And
Yeah.
the challenging part is so many kids are eating so many different ultra processed foods on a very regular basis that
Mm,
their brains have built I don't want to call it a tolerance, but you are living in the state where kids don't even realize how poorly they
mhm.
feel.
Yeah.
And parents don't realize. And I know in my heart, if parents knew that meltdown and that rage after baseball, after having that green ice Gatorade, if they knew that they could not have that happen by
Yeah.
switching out for coconut water or cleaner hydration drink, they would do it. It wouldn't feel like, oh, poor Johnny can't have this and everyone else can have it. It would be more like, oh, I get to understand what is harmful for my child and make swaps instead. And
Yeah.
we don't want to feel when we're taking these things away that we're depriving our kids. It is an opportunity for their brains to really flourish and thrive. And just shifting that mindset, because that can be the most challenging part when we as parents are trying to keep out the dyes and the ultra processed foods, or maybe grandparents too are coming and saying, just let them be a kid. We don't
Yeah.
necessarily want our kids to be like every other kid who
Yeah.
is really so inflamed all the time. And I think that once you are aware of that, it becomes easier and easier to hold fast and say, no, this
Yeah.
is just not something that we do. And for your kids as they grow up, my kids, as now they're teenagers, it's really important that they can then also become more in tune with their bodies and their brains and recognize how they feel after eating certain foods, for better or for worse, right?
Yeah.
And also how that's affecting their goals. Because at some point, your kids, like mine, are going to be going out with their friends on their own and making their own food choices. So
Yeah.
it's not enough for us as parents to say, oh, you don't eat that. That's gross. That's disgusting. That's unhealthy.
Yeah.
That's not going to cut it. But if you can connect the dots for my kids right now, soccer, being great at soccer is really important to them, and becoming
Mhm.
more athletic and really having them notice after, if they do choose with their friends to have the really sugary thing or the thing with artificial dyes, let's notice your mood afterwards, how you get
Mhm.
along with your friends, and also how your practice went or how your game went. And it we really want them to understand how to make those informed choices, because they are going to make those choices on their own at some point.
I love that idea of switching out for what they can't, switching out the Gatorade for the coconut water. My son is at the age where he's really feeling empowered and he wants to oppose our choices and calling us very strict. Even though we live in a very natural environment in Colorado where the parents are asking, does anybody have any diet restrictions? Like we do still have to
Yes.
always bring or more natural cupcake, or it's always pizza every single birthday party we go to. And so we have to go get a pizza alternative for
Yep.
our kiddos. That's definitely become a little bit of a challenge as he's getting older and turning 10 soon. Yeah.
Yeah, yeah. So just having him notice, and when you're younger, the younger you are, the harder it can be to really be in tune with your body and your
Yeah.
brain. But once they start connecting the dots, they're not always going to make the choices that we would like them to make, but at least then
Yeah.
they feel empowered to make those choices, and they can understand also some of the impact and the consequences. And then for us now, when we go grocery shopping, if they do, let's say they're out with their friends and their friends are buying, I always call it Takis because I think they should be taken off the market with the artificial red dyes and
Yeah.
the MSG and the artificial flavors. And it's so popular among kids to want those Takis. But we purposely we go to this grocery store and we look at the chip aisle and look at the ingredients together and come up with great options that are tasty and
Mm-hmm.
they're maybe not perfect, but they're much better than the Takis. And
Mm.
so then he knows he doesn't have to think too hard when he's out to lunch with his friends. Oh, he's going to go grab that bag of Boulder chips, right? Like, or grab the Siete Fuego chips or something. He
Mm-hmm.
knows exactly what he's going to pick and he likes how they taste and he doesn't feel any, quote, different than his friends or he doesn't
Yeah.
feel like he has to be deprived.
Hmm. Yeah, that's wonderful. I had one last question I was going to ask you. I was listening to one of your recent releases with another podcast, and you had mentioned saffron with ADHD. I found
Mm.
that so interesting. My grandmother is Argentinian, and so she cooked with a lot of saffron. It was
Yeah, saffron is that beautiful, for people who don't know, it's a beautiful thread-like spice that gives food that amazing orange color. It's often used in paella, some Indian curries, and it's an herb, a spice that's been known to help promote happiness and support mood.
wow.
There are some good studies now in children showing that saffron, and the dosage used is about 30 milligrams
Mm.
for kids and teenagers, that saffron can be just as effective as Ritalin in supporting ADHD symptoms without the negative side effects.
Hmm.
Because with stimulant medications, we have loss of appetite, we can have tics, we can have rebound in attention or aggression, and insomnia, and problems with height and weight gain. And saffron doesn't have any of that. So I feel food is medicine, but then sometimes we need supplements. And if we can get our
Yeah.
supplements from a food that's been shown to actually be effective, then why not consider it and have that discussion?
Wow, that's beautiful. I love that. Thank you so much. Can you tell us about your book? I didn't know you had recipes in it as well. This is very cool.
Yeah. So my book it's called Healthy Kids, Happy Kids, an integrative pediatrician's guide to whole child resilience. You can see it
Mm,
behind me. It has a yellow color cover. And it's divided into four parts. The first part is lays a foundation of what you need to know as a parent or a practitioner. And I wrote this with
mhm,
practitioners in mind too. So what you need to understand about the gut microbiome and the child's developing gut brain, gut immune, and even gut genetics connection with the
mm,
research there and the data. Okay,
yeah.
this is solid. This is something that we've actually known about for decades, and we
Mm,
need to bring this to the forefront.
yeah.
Part two is all about how do we help your gut microbiome thrive with
Mm,
those five things for microbiome magic: how we
okay.
eat, how we breathe. Has to do with our vagus nerve and nervous system regulation, how we
Mm,
sleep, move, and hydrate. And so gives you tips, really fun, practical tips and worksheets
okay.
on how to do that every day. In the Nourish chapter, I have recipes, including the blackberry fermented lemonade that we mentioned,
Mm,
that have all of our microbiome champions in it. And the third part goes through what happens when something goes wrong. If your child has a persistent health concern, or maybe they need antibiotics, what we need to understand about antibiotics and how we
mm.
restore and recover your gut microbiome, and also identify the top most common nutrient deficiencies in
Oh,
kids.
yeah. Oh.
So that's part three. And then part four is almost like your bedside reference. So it's the top 25 acute conditions in
Mhm,
kids, from fevers to sore throats to colds and flus to anxiety and sleep problems, you name it.
mm,
And how I would address that as an integrated pediatrician. So I give you it. So what I had in mind was if you were a patient and you called me in the middle of the night and said, "Help, Jenny is starting to throw up and it's 2 in the morning." This is
Mhm.
exactly what I would tell you to do. How to use diet and lifestyle measures, supplements, homeopathy, herbal medicines, acupressure points, essential oils, and also when you should call your doctor
Mhm.
and when antibiotics might be necessary. So I have that there more as a reference guide to flip through whenever your kids get sick.
Oh my gosh, that's such a powerful tool. A friend had mentioned a similar type of scenario where you can pull the book and look, and I love this guide. That sounds perfect. Thanks so much for all of your time today, Dr. Song. It's been a treat to have you.
Thanks for having me.
Well, that's a wrap. Thanks so much for tuning in, Changemakers. This is Carrie. And if you haven't done a review for us, 5 stars and a little few words about what you've enjoyed in our podcast episodes, we would really appreciate it. If you guys would like to ever message me, I would love any questions you have or any feedback at info@hearttoheartlife.com. We also have a brand new website, which we're super excited to share. It's hearttoheartlife.com. Thanks so much for tuning in and happy life, happy times, Changemaker families. Bye. Please remember that the information shared on this podcast is educational in nature and does not constitute licensed mental health advice. If you need such advice, you should speak with a licensed professional about your unique situation. Thanks so much, happy listeners.